You're gonna see me put the side of my hand on that bone right in the middle. And as I hold some pressure, I'm just gonna ask Courtney to rock her hips back and forth. Good, we're gonna keep going just a couple more. And then one more each side, and relax. Hi, I'm Dr. Autumn from Specific Chiropractic, and today we're gonna be walking you through what a Webster's Technique adjustment looks like on a pregnant individual. So Courtney's been so gracious to let me kind of show you on her. And as I go through the adjustment, I'm going to be talking to you about what it is, why we're doing it, and the things that we're looking for. So the first thing we always do is we will start with adjusting your neck. It has the most information and input into your brain, and it helps a lot with information into your baby and your pelvis. So what you'll notice me doing is using a scope per neck. This lets us read the irritation on the nerves, and I do this before the adjustment and after the adjustment to make sure everything is clear as we want it to be. As we kind of come up, what I do is I take that reading and I then motion out her neck to see exactly how things are moving and how I want to adjust her. And there's a little adjustment. Perfect. And then, like I said, we're gonna do the same reading kind of post-adjustment because the irritation will clear out right away, which is really, really cool to see. Perfect. Okay, so the first thing we look for in Webster's Technique is we always want to see what is happening with the bony part of your pelvis. So your sacrum is the biggest thing that starts to shift and move during pregnancy. And your sacrum is going to be the bone right here in the middle. It moves two ways. It can rotate kind of right and left, and it can tilt. This tailbone part can actually tilt right and left. So sometimes you get a combination of that where it's rotated and tilted. So I'm looking for all the ways that this could be shifted, because the biggest thing that can happen is if this shifts, it can cause a lot of people to not just have kind of the glute pain here, but it can irritate your low back pain, and a lot of women start to get that sciatica or the pain to the front of their groin. And those are all the things that we never want during pregnancy because we know how uncomfortable they are. So you're gonna notice, first thing I wanna look at is her leg length. So when I come down, and I'm looking at her leg length, I'm seeing if one leg is shorter than the other. And then as I bring her legs up, I'm also doing the same thing. And so based off of that, I'm gonna look for a little bit of kind of motion in her pelvis just to see how things are shifted. And we're gonna do the first part of the adjustment. So the really cool part about adjusting women who are pregnant is you don't have to use a lot of force at all to allow there to be motion in the pelvis or like relaxation in the muscles and the ligaments, because we have so many hormones that change. There's one in particular that relaxes all of our soft tissue, so we don't have to do a lot of force at all. It's very safe and very gentle. So you're gonna see me put the side of my hand on that bone right in the middle. And as I hold some pressure, I'm just gonna ask Courtney to rock her hips back and forth. Good, we're gonna keep going just a couple more, and then one more each side, and relax. Perfect. And then that's typically really all it takes. As I look at her leg length again, I'm looking for them to be nice and even, and already she's so much better than she was. So I'm gonna kind of check again. A little push with her heels to her butt, and that looks perfect. So the next part of Webster's Technique on the back side of your hips is we're gonna work with the piriformis muscle that sits right in the middle from your sacrum to kind of the outside of your hips. That is one of the main muscles that starts to get tight, and that's how we get that like pain right in the middle of our glute. So you're just gonna see me kind of work on that muscle, kind of a gentle massage right out, and kind of a little push to the side. And as we work with that, again, it doesn't take a lot of force, it doesn't take a lot of time to help relax that muscle, because that first part of the adjustment that we did is gonna help it relax a ton. Perfect. And then the last thing we work on is going to be a ligament that connects from your tailbone to your sit bone off to the side. So you're gonna see me work with Courtney, and I'm gonna just kind of, right to the side. My knife edge of my hand just kind of walks right down to her tailbone, and then I'm gonna come off to the side and I'll hold just a little pressure on that ligament. And all I'm looking for is I'm waiting for it to relax, and then as soon as it does, we're gonna move on. Again, it doesn't usually take a lot of pressure or a lot of time to do so. Perfect. Okay. So the next part is we're just gonna look at the rest of her spine and adjust her accordingly. So you're gonna see me just give a little bit of pressure into her spine. I'm seeing where she also needs to be adjusted. Right, you're gonna feel one hand on each side of your spine. Take a big breath in. Good, breathe all the way out. And a little push. Good. And we've got one more right down here. Kind of same thing, breathe in. And out. Little push. Good. Okay, so when we work on the front of your pelvis, we're also gonna look for what's happening with her pelvic bone. So your pubic symphysis, firstly. So you'll see me kind of walk my hand down and I'm looking for just irritation that's gonna be here and kind of let that relax a little bit. We also work with a muscle in the front called your psoas, kind of runs right through the inside. And then the ligaments we work on in the front is gonna be your round ligament that is gonna connect to your uterus. And together. So this is helping me see actually how much stress is on her psoas muscle itself. And if it's more on the right side or the left side. Good, and you're gonna go arms down. So you're gonna see me again kind of use the side of my hand. I'm gonna walk my hand down right until I get to the top of her pubic bone. And just kind of a little bit of pressure. Are you sore there about it?
Yeah.
Yeah.
Yeah, a little bit more than normal.
Okay. The next thing we're gonna do is work on that psoas muscle itself. So I am finding kind of the front part of her hip bone here. And I'm coming right on the inside of it. And that muscle kind of runs all the way down, but we're gonna be working on the top half. So you're just gonna see me give a little bit of pressure in. Amazing. So what I'm looking for is her hands to be nice and even, which they are that second time, which is awesome. And that last part is, again, working on that round ligament in the front. So you're just gonna see me kind of find that. And just like the ligament in the back, you do not have to use a lot of pressure in order to help kind of take some tension off of that. Beautiful. So that's really it. Honestly, Webster's technique is so gentle and it's so effective in helping take pressure off your pelvis, off the muscles, off the nerves, so that you have so much more comfort in pregnancy. I think a lot of people think that you have to be uncomfortable or it's just normal to be uncomfortable in pregnancy, and you just don't have to live that way if you don't want to. So if you're interested in a consultation with me or just have questions for the office, just click the link below and we'll be happy to talk to you and get you in the office if you want to. All right.